My name is Alisha and the title of my presentation is The Effect of Caffeine on Endurance Exercise. So caffeine belongs to the drug class methylxanthine. It is one of the most researched components that has a vast majority of dietary contributions, and it is one of the most commonly consumed substances which presents in plants and other products. So caffeine has a lot of well-developed research on how it can be added to the normal diet. It can occur naturally in a variety of plants, including coffee beans, tea leaves, cola nuts, and cacao pods. It can also be found synthetically in medicines, foods, and drinks. So caffeine is typically consumed through soda, coffee, energy drinks, and tea. The effects of caffeine are dependent on the quantity and the type of caffeine that is consumed, and it also depends on the demographic differences among people. This little chart just shows how much caffeine is found from decaf coffee all the way through brewed coffee and commonly consumed caffeinated beverages. There are many cognitive effects of caffeine. Caffeine is able to improve our intellectual performance and cognitive performance as it enhances our working memory when it's being used slightly. It can cause improvements in reaction time, and it can work as a mild stimulant in those that are fatigued. It can also help reduce cognitive decline in some users, and the effects of caffeine are considered indirect because it cannot affect our cognitive function directly, but through the different ways through here, it's indirectly affecting it. Caffeine is a supplement that's consumed which causes the central nervous system to be stimulated. So a stimulating drug causes a speed up in the messages between the brain and the body. There are three mechanisms in which this occurs. The first one is the psychostimulant effect. So caffeine binds to adenosine receptors and it indirectly affects the release of neurotransmitters. Examples of neurotransmitters that are affected by caffeine are norepinephrine, dopamine, acetylcholine, serotonin, and glutamate. A change in these neurotransmitters can alter our mood, our memory, our alertness, and other cognitive function. So the second mechanism is the mobilization of intercellular calcium. So it can promote calcium through the sarcoplasmic reticulum and plasma membrane. And the third mechanism is the inhibition of phosphodiesterases, which prevents the cyclic adenosine monophosphate from being enzymatically broken down. This also affects our hormones. These two are not as common as the first one, as it takes a lot higher of an amount of caffeine to affect these, which can get towards toxic levels for us. And then this just shows a synapse and like a normal synapse versus a synapse with caffeine, and it shows the binding of the adenosine receptor to block its action. So other effects of caffeine, it can affect the immune system, the digestive system, the respiratory system, and the urinary tract. Many of the effects of caffeine are mediated via the sympathetic nervous system, so this causes an increase in our heart rate and our blood pressure. Caffeine can also act as an antioxidant. So in our bodies we have free radicals who need an electron, and these are toxic for humans as they can damage our cells. And antioxidants act as an electron donator, so they'll donate an electron to the free radical, and once an antioxidant turns into a free radical, it's not harmful for us. Caffeine also affects our energy expenditure. It can stimulate lipolysis and the increase in energy expenditure by 13%. This increase in energy expenditure can help increase our muscular performance. So endurance exercise is also known as aerobic exercise. It is done in order to increase your respiration and your heart rate, which helps promote keep our circulatory system healthy. So this shows different athletes, so professional, collegiate, recreational versus male and female, and then different types of athletes. And then it shows their percentage of caffeine supplement use. So there can be negative physiological effects of endurance exercise if it's not performed correctly. If endurance exercise is performed in a high intensity and volume, it can cause negative effects. This is when you don't give yourself adequate rest time. Extreme endurance exercise can cause myocardial fibrosis, ventricular arrhythmias, atrial fibrillation, and atherosclerosis. So these are all different things that can affect our heart. But there are many positive physiological effects of endurance exercise. So it can improve our metabolism, it can reduce our cardiovascular disease risk, and this shows the different high, medium, and low levels of fitness, and it shows the risk of cardiovascular mortality. So there are positive effects of caffeine in endurance and exercise. These include ergogenic effects, so this is how fast we perceive fatigue. Caffeine can increase the duration of exercise as long as the caffeine effects are also increasing. It can cause longer duration of endurance exercise, and it can increase our central nervous system effects, which can lead to an increase in our performance. It also affects the pulmonary system. This includes influenced ventilation, end tidal oxygen partial pressure, and increased overall efficiency of oxygen uptake. So caffeine can also affect our cardiovascular system. So caffeine can make it take longer to reach maximum values of our heart rate and our stroke volume. So it can also affect our muscular system. So it increases our active muscle oxygen saturation, and it causes a decrease in duration it takes for muscles to fatigue. So this shows just the different muscle oxygen saturation and how it changes with caffeine. There can be negative effects of caffeine in endurance exercise. So caffeine's a fast-acting drug, so the effects wear off rapidly, so it takes a greater amount of caffeine for a longer endurance exercise bout. It also affects the way that we perceive fatigue. So someone who doesn't consume caffeine while they're performing endurance exercise takes a while to get to their perceived fatigue, versus someone who consumes caffeine, the effects will hit them kind of like a wall once they wear off. And thank you for listening to my presentation.